Good afternoon. Thank you for joining us once again. Today we'll have reports from the Commissioner of Indiana's Department of Transportation, Joe McGinnis, which you'll be able to share some more details about our community crossings program and some workplace safety zone progress and measures that are put into place, specifically about the community crossings program, something that we started back in 2016, and now it's well over $700 million of local and state dollars that have been partnered together in our bigger cities and in our smallest towns. Earlier this year, we had to push pause on this latest round. Wanted to be prudent, wanted to make sure that we had the funding from a state perspective to go out to locals to get these projects, many of which would just kind of sit on the shelf. I mean, we've got our local and our state projects that are ongoing and have been ongoing, but this is on top of all of that. And I'm just thrilled and pleased that we're able to get that back on track, that program back on track. And so you might go into detail about community crossings and what that means for the fourth quarter, and you can give a more exact time frame in November, I guess, the award. But folks will start applying here soon. And then, Dr. Box, you've got a number of updates to make, thankfully, one of which is a lot of our quite frankly, of our new cases in a specific age group. We're not surprised by that. You've touched on this more than you've elaborated on it, not just alluded to it, but just the congregate living that's occurring on our college campuses and kind of the impact that has had on our overall outlook. And then some progress made on our dashboard with all of our schools participating and all the cases that are within those individual schools. And then also, if you would, I think this is on your to-do list, give us an update on all those, the progress that we're making locally with all those additional testing sites. We infused local, county by county, with dollars so that they had the ability to make investments in terms of testing for over the next 2 years, which can give a lot of confidence and comfort to folks to know that it's close at home. Also, we're approaching, and I hope you go into this is something I myself like to learn about, we're approaching this third round of the Fairbanks scientific study. And so you'll go into detail about that, I'm sure, but I would just say personally, if you are contacted, please participate. This is, like we've said before, this is our radar. This allows us to kind of project or see in terms of, as close to a crystal ball as we'll ever get in terms of having a radar for us to see what kind of spreads truly occurring or projected to be occurring. And so please participate if you get that call. And while I'm at it, pleading for participation and for help, we've also been contacted by the American Red Cross, and hopefully that's on your screen right now. They need our help, and not just here in the state of Indiana, but across the country. Obviously, if you turn on the national news, all over the country there is need, specifically in 10 states are in need, some of which is for food, some of which for shelter, and just the horrific impact that some of these natural disasters have brought with them. We're talking about the windstorms in Iowa and Illinois. We're talking about the relentless wildfires in California and Oregon and Washington. We're talking about Hurricane Laura in Louisiana and in Texas. And so obviously with the rainfall and the flooding down in Alabama, the list just seems to go on and on and on. So there is need associated with that. And I would just say, if you're able, first and foremost, we're under a lot of stress and strain here as well, and we are profusely thankful for everything folks are doing to help their immediate neighbors in your community. But if you're blessed and able and can help, there's ways to do that, specifically healthcare, kind of our frontline workers. There are ways to pitch in these other states, on the ground in other states. And then you can also volunteer by calling that number 1-888-684-1441, or just go online to redcross.org/volunteer. And they will follow up with you. They are in that much need. Also, just want to make a note for volunteers, speaking of them, here at our local food banks. We're in the process of all of our food banks are calling back their volunteers. They are appropriately equipped with PPE to keep volunteers safe. So we would ask that if you were giving of your time and talent and treasure in the past to food banks, we would ask that you make contact and look to return there as well. And then also just kind of a regular reminder, and this is getting closer and closer to the deadline, the due date, and that is to make sure that every Hoosier is taken into account in terms of the census. That September 30th is the last day. So please, 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 there as well, participate. And, I looked back at the records 10 years ago when we did this. Indiana ranked 7th. And in the good doctor's jargon, that would put you in the 3rd row. And we'd like to be in the front row. Actually, we ranked 3rd 10 years ago, so we were in the front row, but now we're ranked 7th. So now we're in the 3rd row, and we're trying to get back to pole position. And so with your help down the stretch in these final laps, so to speak, let's shoot for number 1, go from 7 to 1. And that just reminds me of another event coming up, and that is the election. And if you feel so inclined and have the time to volunteer with your county clerk to work on the elections coming up in November. This is a great nonpartisan way. Again, Indiana, very fortunate to have so many civic organizations, Kiwanis and Rotarians and associations that do so much for their community. And we know that there's going to be a excited electorate out there to express their voice. And if you would be willing to participate, I'm sure 92 county clerks would appreciate your hand. So with that, I'll kick it over to Dr. Box, and you can give us some updates, and then Joe will go to you.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 624 additional cases of COVID-19 in Indiana, which brings us to 107,809 total, the number of Hoosiers known to have COVID. We also saw 12 additional confirmed deaths. To date, 3,247 Hoosiers have died of COVID-19, and another 225 are believed to have died from this disease based on their clinical diagnosis. As of September 14th, 809 Hoosiers were hospitalized with COVID or COVID-related symptoms. While that's higher than our low point in late June, it's encouraging to see that number of patients admitted each day has fallen from 87 in late July to 62 as of September the 10th. Our 7-day positivity rate for total individuals tested was 4.7% as of September the 9th, while cumulative rate for all tests is 6.2%. A few weeks ago, we unveiled our color-coded county map that uses 2 metrics to evaluate how we're doing. Those are the number of new cases per 100,000 residents in the past week, the percent positivity as determined by the number of positive tests divided by the number of administered tests. Today's map shows 2 counties in orange, Delaware and Monroe, and both are due to congregate living settings and large-scale testing tied to university settings. This is a big improvement over where we started, which means Hoosiers are doing a lot of the right things. This is proof that wearing a mask and practicing social distancing does make a difference, so keep up the good work. These improvements come as schools have opened, but we are still watching to see what increased spread we might see from the Labor Day weekend. I also want to share our latest data on hospitalizations and recovery from our partners at Regan Street. To date, we have looked at 101,226 cases. Of those, about 21% visited the emergency department, which is consistent with last week. A total of 11,858 were hospitalized, which represents 12% of all positive cases and is also holding steady. Of those who were hospitalized, 20% were admitted to the ICU. That represents 2% of all positive patients. Those numbers are consistent with what we saw last week. 76% of hospitalized patients have been discharged. Of the remaining 24%, 6% are believed to still be hospitalized. 18% are known to have died while hospitalized. Regan Steady increase in the percentage of total cases among children throughout this pandemic. So far this month, the 0 to 19 and 20 to 29 age groups represent nearly half of all new COVID-19 cases. Much of this is due to increased testing in these age groups, especially in the university setting. But we also continue to see cases tied to gatherings of young people, such as sleepovers, parties, and other gatherings. Fortunately, we don't see a lot of COVID hospitalizations in children and young adults. We have had 16 confirmed, actually it was just this morning confirmed 17 MIS-C cases in the state among children under the age of 18. But thankfully, all of those patients have been discharged. But the CDC has found that half of the deaths in individuals under the age of 21 occurred in the 18 to 20-year-old age group. So we need our younger Hoosiers to understand that they are not without risk. We've done some early analysis of cases by grade level, and as you can see, the vast majority are occurring at the college and university level. We saw those sharp increases begin around August 20th. Our kindergarten through grade 12 levels have remained relatively stable since late July. But we do also see almost 19% of our cases among high school students. As more schools return in person, we need to pay attention to these data and recognize that peer-to-peer transmission is occurring more frequently in teenagers and young adults. This is likely because these age groups are less likely to observe social distancing, don't wear their masks regularly, and have larger social bubbles. We hope to gain a better understanding of where these cases are occurring with the new school dashboard and reporting system that we're preparing to launch. We have sent a survey to all schools of the Indiana Department of Education's contact list, asking them to designate 2 representatives who will access the new portal and enter these cases. We've heard back from about 60% of the schools so far and have had some emails bounce back. We're asking schools to report their historical data from when school began through today by close of business on Sunday. Schools that don't submit data will be listed as not reporting. So please check your spam filters, and if you haven't received an email from us asking about these contacts, reach out to us. We want to make sure that we capture the most complete data possible. We're doing some pilot testing of our portal this week so that we can make that live for our schools on Friday. Our goal is to have a snapshot of historical data to show you next week and then present preliminary data by September 30th. We know this is a fluid process and expect to continue to add schools over the next few weeks, just as we did with our long-term care facilities. I also want to provide a brief update on testing availability. As of today, we're showing 253 testing sites across the state. Testing is accessible to Hoosiers now more than any other time during this pandemic, and the number of sites is going to continue to increase. That number includes 40 of the 95 planned local health department sites that I talked about last week. Some of the local health departments are using their own reporting systems, so we don't have data on how many they've tested as of this time. But those that are using the Zotac platform have already tested more than 4,600 Hoosiers. We're excited to see these numbers grow as the remaining counties come online because these local clinics represent sustainable community-level testing. On another testing note, I want to share some updates about labs that we have onboarded in the last couple of weeks. Last week, I mentioned about 50,000 results coming from the Vault labs that would impact Monroe and Tippecanoe counties. Those results are all now included in our dashboard. They include more than 270 positive results that hadn't previously been reported to us. The majority of those occurred in Monroe County. We have been working closely with IU Bloomington to ensure that we are getting an accurate count of students who have been tested. And we want to encourage any student who lives on campus or even in an off-campus apartment to use their university address when getting tested. This will help to ensure that we know which cases are associated with the university and distinguish those between the broader community. I also want to make you aware of a situation involving another out-of-state lab that recently submitted results to us. We received results from a newly onboarded lab that contained a file that included incorrect information due to a technical issue on the lab's part. As a result of that, we are removing 469 positive results that had been added to our dashboard this week, and we are expecting a corrected file from that same lab today, which will soon hit our dashboard. I said before that we're adding data as quickly as we get it, and our dashboard has grown significantly since we first launched it in this early part of the pandemic. We recognize that we will continue to encounter situations that require us to correct the data and will continue to provide these explanations so Hoosiers can understand what changed and why. Finally, I want to remind Hoosiers that we're preparing for the third round of testing as part of the IU Fairbanks School of Public Health prevalence study. About 30,000 Hoosiers across the state should have received postcards saying they were randomly selected to participate in the study. This includes children ages 5 to 12. Please participate if you can help us to better understand the prevalence of COVID-19 in our state. The prevalence study begins September 29th and runs through October 3rd, and we will have some supplemental sites on October 4th and 5th to ensure we're including Hoosiers from all corners of the state who represent our most diverse populations. Thank you.
Pardon me, Doc, but did I hear you say, or would you repeat it, that masks are working?
They are working.
Physical distancing
They are
is
working.
working, and the numbers don't lie.
The numbers don't lie. The data shows it clearly. In fact, like Dr. Sullivan shared with us over the last couple of days, Indiana has one of the lowest spread rates in the nation
That
right
RNet
now.
number. So less than 1.
Yeah, it's less
correct?
than 1, which I was very proud of.
0.94 to be exact.
And we're going for 0.3, right, Dr. Sullivan?
More to come. Good. Well, I mean, I don't want that lost on anyone, that what we're doing is working, and it's allowing us to not just stay open and continue to reopen, but to continue to do it in a safe way. And so when you're talking about, first and foremost, safety and doing it safely, our lives, but also the equal impact that it has on our livelihoods and our economy and everything that's tethered to that, including our well-being.
As you've
Mental
always
and
said, that
physical.
delicate balance.
Yeah, and so I just want, it's not what we're doing, it's what we all are doing, and it's what you are doing to make sure that Indiana's, quite frankly, one of the most open states in the country right now.
Tried dropping her off.
And when
They
you
got there really quick
look
today.
at our unemployment rate, Fred Payne
Yeah,
is
he's
here,
gonna,
and
do his
Friday,
job
I
and
guess
drop
Fred
off
will
later,
get the
I
latest
think,
updates, but,
so.
you know, our unemployment rate had been
Hopefully,
at
by the time you get there,
17.5.
hopefully he'll
It
be
was
coming back
adjusted up
around.
at 17.55%,
They got there
up from
really quick
3.2. And the last figure that we had, we were at 7.8, and we project that it will continue
Yeah.
to tick down. So we want to
I think so.
continue this momentum and
I think so.
and make sure folks who have been crushed by this in terms of their savings, their job, their business, that we continue to feel the pressure to keep crushing it on our end, meaning attracting more opportunities and making sure the resources are here so people can reskill or skill up to pursue these opportunities. So thank you. I just didn't want that. I wanted to underscore that because that's the proof that we're on the right track, and we need to continue to be vigilant and not just celebrate that we're at a 7-day 4.7 positivity rate, but it's got to do with what's coming as well, including getting colder outside, more people going inside, the flu plus COVID, making sure that we don't overwhelm our hospital network. So just critically important, but kudos to Hoosiers who have been masking up, who have been physically distancing themselves, so it's not like we're all moths to a flame. And then unknowingly, and we just know, you talked about the students and where that uptick is occurring. Well, you're right, you said, it's not probably going to hospitalize that individual, but what happens when it's passed on? The next person that they see, just like they contracted it from someone that they just saw. So thank you for that report. It truly does give us the pathway forward.
Fox gave us. I don't think it's any coincidence because Hoosiers are getting out and about again. And our traffic volumes around the state are rebounding to near pre-pandemic levels. I haven't been on a while, but I think the charts that I was showing before, we were in the neighborhood of 45% vehicular traffic, particularly passenger vehicle traffic, down. Now, the 2-week period from August 23rd through September 6th, the overall traffic compared to the 2 weeks prior to March 24th, the pre-pandemic where we really got hit, is only down 13% compared to that period of time. So we're starting to get back. People are starting to get back to work, starting to get back more involved in schools and extracurricular activities, back to shopping and spending money here in the state of Indiana. The even better news is for the freight traffic in the state. And we are actually at or slightly above freight traffic pre-COVID levels, which is a very strong indicator based off of the numbers you gave, and hopefully we'll have some even better numbers on Friday from DWD on our continued economic recovery. And so those freight numbers, I think, are very critical as we're looking out into the very near future and the long distance future, that we're slightly higher actually than where we were at pre-COVID levels. So I think that's a great indication. And you all are doing it with a bunch of orange barrels and barrier walls scattered around 92 counties around the state of Indiana. And as you mentioned, the weather's going to be turning cooler. Construction season is still in full swing, and we will continue to manage and to facilitate hundreds of projects around the state. Typically, road construction oftentimes will conclude sometime in mid to late November. As long as the weather cooperates, we're at over 1,100 projects this year. We need some cooperation from Mother Nature. So, as long as the weather cooperates, we will continue to push these construction projects even into December. Some of you may not appreciate that, but we were making sure that we're using the dollars that are provided to us efficiently, and we want to get these projects done for all of you. I can't say this enough. I say this every time I speak. Please continue to watch the work zones. Slow down. Speeds are up. I see it every day, particularly on the interstate, so speeds are up, but especially in those work zones. Put the phones down and watch our speeds. Speaking of hands-free, we are now 3 months into the state's hands-free while driving law, and we continue to work with law enforcement, state police, and our local law enforcement partners and our industry partners as we continue to spread the word and educate Hoosiers on embracing hands-free ways to use their mobile devices safely while we are driving on Indiana roads. Total work zone crashes and fatal crashes are both down more than 50%. This year, and that speaks to the commitment from law enforcement and to our contractors and to you Hoosiers to making sure that our employees, our contractors, and you get home safely at the end of the day, because that's the most critical piece of all of this that we do. Now on to what you mentioned and what's on the screen. Some even more exciting news here in Indiana as we are executing our Back on Track plan. It's in full swing. We are happy to announce today that the program that so many in local government covet, our Community Crossings Matching Grant Program, is back. And Community Crossings, the Matching Grant Program, as the governor mentioned, began in 2016 as a partnership between the state, cities, towns, and counties to invest in local road and bridge projects. These are not state highways. These are not U.S. highways. These are not interstates. These are strictly, I call it our Main Street Indiana program, and that's strictly what these dollars are for. And it is geared towards leveraging our state matching dollars with those locals for existing roads and bridges. This isn't a new capital program. This is to take care of what we have. These projects encourage economic development by ensuring that the first and last mile of our transportation network, which we all know from many businesses and healthcare and education, is a local road. And we want to make sure that we are able to support it through freight and with the freight and logistics, and allowing those companies to grow and to create jobs here in Indiana. This program has been, as I mentioned, has been incredibly popular. To date, the state has invested more than $730 million in local projects just in this program alone. And I'm also proud to say, and Governor, you've been along for many of these road trips, there have been projects funded in all 92 counties. So that's a great accomplishment to the locals for getting engaged and partnering with the state and NDOT for these dollars. In January this year, We awarded more than $120 million for these local projects, many of which are probably underway. You're seeing them in your own communities now, or they've recently been finished. And we planned on doing a summer call that first Monday in July, but as many of us found out, the COVID-19 pandemic had other plans for us. So we had to put it on halt because of decreased traffic volume due to the pandemic. Created revenue uncertainty for us and for the locals and for this matching grant program, which is the budgeting source for community crossings. As traffic rebounded, as I mentioned, over the summer months, we've analyzed the existing funding available as well as what we anticipate to come over the next few months of this fiscal year. And I'm excited to share today that we are moving forward with our second community crossings call for projects of 2020 this fall. Obviously been delayed 2 or 3 months, but nevertheless, we're here. And so proud to announce that our application window will open next Friday, September 25th, and we will accept applications through the close of business on Friday, October 23rd. And then those projects will be scored. It is typically, we do get requests for more dollars than we have, and so it is a competitive, very competitive program, and so we will score those projects and make those funding award announcements sometime in mid-November. Like I said, back in July, we didn't know whether we would be delaying or canceling community crossings call for this part of 2020. But we know how much of an impact that was to the program for many locals and the job creators in our state. Couldn't be happier that this project or this program is alive and well as we enter the fall of 2020. We are proud of the continued partnership with the local government to deliver on our commitment to take care of our roads from interstates to main streets. And Governor, I hope that sometime later this fall,
But wait, there's more?
we get to go back out and present the big checks that you've seen on the screen and mingle with some of our local partners and provide them with some of those matching grant dollars. We'll do it safely, Dr. Box, but I want to, looking
right.
forward to hopefully being able to get out there this fall and award some of those big foam checks. Thank you.
Let me put you on the spot. Give me, you've got multiple examples, because I think I got a few rattling around up here too, but give them an example of the smallest project that wouldn't have gotten done without this program or partnership.
Yeah, I think one of the coolest stories, and I know I've told you, is a community down on the Ohio River called Mockport, Indiana, less than 100 people population, and it's been about 2 years ago now. They applied for some dollars and they received over $100,000 in this matching grant program. They had about 3 miles of roadway in the entire community, and without the injection of this $100,000, I don't know that they would have been able to just continue to put a Band-Aid on this problem, and so. They were very grateful. I think it's one of those really cool stories of truly impacting Main Street in Indiana, where you have less than 100 people that live in the community. And that's across the state.
Right.
We have it on the Ohio River, we have it on Lake Michigan,
right,
and everywhere in between. And so, and I've seen some of the economic growth that's come from this. My own community, 2016, when I was mayor of Franklin, I was the beneficiary of one of these $1 million grants the very first year. And if it weren't for that and the project that we did on Wayne Street, Indiana, just south of the courthouse, we had some local investors invest $5 or $6 million into an old building that coincidentally, where they manufactured the uniforms for the movie Hoosiers. It wouldn't have happened.
You had to get that in there, didn't you?
I had to get my basketball reference in there, but it wouldn't have happened.
And just real quick, just give the city and town population breakdown, kind of over 50,000, 150,000 for the city town, and then the county.
The counties, yeah. So by statute, we separate these dollars out 50%, 50%. So the smaller communities, the smaller counties have just as much ability and competitive edge to get these dollars as Indianapolis or South Bend or Evansville, for that matter. And so those dollars are parceled out, and we make sure that they are split evenly 50-50.
Yep. Counties and cities, different
Same.
applications. Yep. Perfect. Okay. And you did say masks are working. No, just wanted to get that in there for the third time. We'll go. Rachel? Why don't you go right to Q&A? Dan, good afternoon.